The weirdest thing that ever happened to you that made you think that God was real? And I'm not talking about believing in some kind of universal.
So I used to work for a pulmonologist, and the pulmonologist decided randomly one day that he was going to sell the office and shut it down, and everybody was going to have to find a new job. Well, this kind of made me a little bitter. I was angry. I was angry with God because I thought that was my forever job, and I didn't really want to find a new job. I was almost 50. I liked the job I had. However, I had no choice, so I found a new job. Found a job at a cardiologist office. So I'm almost 6 months in. Everything's going great. I'm at church on a Sunday, and I start to get chest pain. And I thought, that was an odd pain. I never felt that before. And then it happened a second time, and I thought, okay, well, you're getting my attention. And then it happened a third time. And I thought, maybe I should go to the ER or say something to my husband. Maybe I should address this. Now, let me give you a little background. When I was young, we never was taken to the hospital unless you seen blood or you had a limb hanging. You just didn't go to the hospital. So I'm kind of stubborn that way, and I have high tolerance for pain. So I just went on home from church, and I laid down on the couch the whole day, rested. Monday morning, got up for work. I felt a lot better. Went to work, and I had a lot of dictation to do. So I was sitting there doing my dictation. My left arm kept going up, and I kept shaking it, thinking, this is odd. And so it happened a few times, and then I just started not to feel well again. And I thought, well, maybe I'm coming down with something, and I need to go home and lay down again. So I went to my office manager. I was going home sick, and I'd be home the next morning. Everything should be fine. I just thought I was coming down with something. So I'm walking out of my office. Now, let me just tell you this. Our office sat in the back of the parking lot of the hospital. So I'm walking out of the office, and I literally hear the Lord tell me, Valerie, you need to go to the ER. You need to go to the ER now. Now, normally, this is just something I wouldn't do. But because I heard that voice so distinctly, I followed the direction, and I went to the ER. Checked myself into the ER. Told them, I hadn't been feeling well. I had some chest pain, and I just wanted to get checked out. Didn't tell them that I worked for a cardiologist, not just a cardiologist, but one of the best cardiologists in our area. So they, of course, take me back, and they do all the tests. They do the blood work, and my blood work for heart issue came back 1 point elevated. So the hospitalist came in to go over my symptoms with me, and I told him everything that had been going on, and he said, well, your blood work came back 1 point elevated, so we're going to go ahead and keep you overnight, and we're going to do a stress test in the morning. But just in case, we're going to do a CT with contrast. So I'm like, okay. So at this point, I had been there for 2 hours, hadn't called my family, heard about that. So called my family, told them I was in the hospital. They were going to keep me overnight. So, of course, both my daughters take off work, come to the hospital. My husband was a truck driver, and he was already 16 hours from the house. Called him. So they did they did the CT with contrast, and the hospital was packed. They finally admitted me in the hospital later that evening. They put me down in a room. And the nurse had come in and was asking me all these odd questions. And my daughter was a nurse. And I kept looking at my daughter, who was sitting in front of me. And I could tell that she kind of knew what they were getting at, but she wasn't saying anything. So another nurse came in, and it was a younger nurse. He was fairly new. And I thought, well, maybe I'll ask him, and he'll slip up and he'll just tell me. So I asked him, if he could tell me if my CT came back, if they found anything on my CT. He said, no, ma'am, I can't tell you anything, but that nurse that was just in here, she went outside to get onto the doctors and have a doctor come up to talk to you right now. So I look at my daughters again, and instantly I see, fear on their face, and I get a little fearful, but still I'm okay. And about 10 minutes later, a doctor comes up, and he says, ma'am, I need to tell you that you have an aneurysm. And I said, okay. I worked for a cardiologist. I knew an aneurysm could be treated with medication. He said, ma'am, it's a very, very large aneurysm, and it cannot be treated with medication. It is on your ascending aortic valve, and they are going to have to cut you open. So he walked out, and I'm still kind of in denial, and I look look at my daughters, and the nurse came back in, and the nurse, asked me if I had any questions. And so then I decided to tell her, I work for a cardiologist, and told her who he was. And she goes, well, if you work for a cardiologist, you would have his phone number, right? And I said, well, yeah, of course I have his phone number. She said, well, if I work for a cardiologist, I would probably call him and ask him, to see what's going on, so he could give you more information. So I messaged my cardiologist that I work for. I told him what's going on, and he said, give me a half hour. I'll look into your chart, and I'll call you right back. Mind you, this is like at 9:30 at night. So exactly maybe 29 minutes later, I get a call back, and he says, Valerie, you have a very large ascending aortic aneurysm. It is measuring at 5.7 centimeters. They are going to have to cut you open to repair this aneurysm. You are not going to have that done here. I know a doctor in St. Louis that specializes in this type of aneurysm. I've already called him, and he's agreed to take your case. So first thing in the morning, there will be no stress test. They will come and pick you up by ambulance, and they will take you to St. Louis to operate on you to repair this aneurysm. And so, needless to say, the next morning I took an ambulance, went to St. Louis, got to St. Louis, talked to the surgeon there. The surgeon remeasured, and he said that the aneurysm was actually 5.9 centimeters. So he did check my vitals, asked me how I was feeling, and I was feeling okay. I was just hungry. I hadn't ate anything in 2 days. So he said, if it's okay with you, I just got out of a long surgery. You're doing well. I'll let you eat something, and we'll do your surgery first thing in the morning. So that was fine with me. Everything went good. So they did my surgery. It was a long surgery. It was a hard surgery. The surgeon went in to talk to my family after he operated and repaired the aneurysm, and he said that the aneurysm was already descaling, which means it was getting ready to explode. He said within 2 weeks, someone would have found me on the floor, and I would have been dead before my knees buckled. So, do I believe in God? I absolutely believe in God, and I believe that God puts you where you need to be where you need to be, and gives you what you need when you need it the most. He knew I was upset about leaving the pulmonologist's office. He put me in a cardiologist's office with one of the best cardiologists around that could get me the treatment that I needed. He took care of me like he always does. He had my back. And he told me to go to the ER. Had I not listened to that voice that said, Valerie, you need to go to the ER, there was no doubt in my mind that I would not be here right now. So yes, I believe in God, and I will tell the world He is real and He loves you.